My stomach's starting to hurt. It's like every time I eat, like my stomach aches.
I really think you should go to the doctor and get that checked out.
So Gina, what brought you in today?
Every time I eat, my stomach just gets really bloated, and then I have like really bad diarrhea.
What are some of the foods that you eat before this happens?
It's like pancakes, pizza, sandwiches, foods like that.
So what I think it is something called celiac disease.
Celiac disease is an inherited autoimmune disorder that is caused by the ingestion of gluten. Gluten is a protein that is found in many plants such as wheat, rye, and barley. This protein is commonly found in many foods. There are multiple causes for this disease, including genetics, an external trigger such as an extreme emotional or physical experience, diet, autoantigen enzyme, or the production of pro-inflammatory cytokines.
Sometimes people don't have any symptoms. The most common symptoms of celiac disease are cramping, itching, lactose intolerance, skin rash, or weight loss. But the most common symptom is diarrhea.
Okay, so my plan is we're going to do 2 diagnostic tests to see if you have the celiac disease. The first one's going to be a TTG IgA, and the second one's a genetic test.
The most common screening test for celiac disease is called TTG IgA test. It is positive for about 98% of patients with celiac disease who are on a gluten-containing diet. The same test will come back negative in about 95% of people without celiac disease. There's a slight risk of a false positive test result for people who have an associated autoimmune disorder. Because of the potential of a false antibody test result, a biopsy of the small intestine is the only diagnosis. Another test for diagnosing celiac disease is a genetic test. People with the disease carry one or both of the HLA, DQ2, and DQ8 genes, and so do 40% of all people. Carrying those genes is not a diagnosis, but genetic testing can help you rule out if you ever develop it. However, if you do carry HLA, DQ2, and/or DQ8, your risk of developing celiac disease is 3% instead of general population risk of 1%.
So, the results for your 2 tests came back positive, but to get a definite screening, we're going to do something called an endoscopy with a biopsy. So what that means is we're going to put you to sleep. It's a very simple procedure, but we're going to take a small device with the camera and a scope on the end, and we'll put it down your throat, through your esophagus, through your stomach until we reach a part called the duodenum, and that's the part that we're going to look at to see if the celiac disease is present. And we'll also take a small scraping of the inside of the intestine so we can send off to lab.
The sample they take from the small intestine, specifically in the duodenum, the area affected by celiac disease, is analyzed for damage and inflammation. The pathologist will look to see if there is noticeable crypt hyperplasia with a decreased villi ratio. Crypt hyperplasia is when the grooves, aka crypts, between the villi are elongated compared to a normal intestinal lining, which has short grooves. This will decrease nutrient absorption. Another key factor is blunted villi, which is the shrinking and flattening of the villi due to repeated gluten exposure. At the base of the villi, there will be an increased amount of T-cell lymphocytes. Enzymes located on the brush border are also drastically reduced. Lactase is an example of one of the brush border enzymes responsible for splitting lactose, milk sugar, so it can be absorbed. The endoscopy itself may also show scalloping and or flattening of duodenal folds, fissuring over the folds, and a mosaic pattern of mucosa of folds.
When we looked into your small intestine in the area called duodenum, we found some inflammation that was caused from the celiacs. We sent the biopsy sample off to the lab, and the results came back and showed an increase in epithelial lymphocytes, or a type of white blood cell indicating an immune system response. We also found shrinking and flattening of the villi, which is caused by repeated gluten exposure. Then lastly, here it indicates some other abnormalities in the epithelial cells that differ from that of a normal duodenum.
Celiac disease is a chronic autoimmune disease, which means that you cannot simply grow out of it. The only known treatment for celiac disease to date is a gluten-free diet, which means the elimination of wheat, rye, barley, triticale, and oats not labeled gluten-free. Annual physician follow-up is required to identify nutritional deficiencies, address symptoms that may still be experienced, and confirmed adherence to the gluten-free diet. The diet heals the villus atrophy in the small intestine, causing symptoms to resolve.
Okay, Gina. Well, I'm really glad you came in today, and I'm glad we finally got this figured out for you. So if we just, stick to that gluten-free diet, then I hope I don't have to see you back in here again, okay? It's nice meeting you.
Thank you, I appreciate it.